Young minds across the African region will showcase their ability to question, analyze, and innovate. This is more than just a competition. It's a platform to inspire the next generation of leaders, innovators, and thinkers. Date 7th December 2024. Time 5 p.m. West African Time. Location Zoom. Don't just watch the future unfold, be a part of the movement that shapes it.
Good evening, ladies and gentlemen. Good evening, everyone. You're welcome to the highly anticipated grand finale debate of the African Digital Health Students Network. Can you all hear me?
Yes, you're
Okay.
audible. Good evening.
Okay, yeah, good evening, everybody. How are we all doing today? I'd like us to respond. Then I'd like us to respond with,
Yeah, we can.
where you're from, and just say your name. You don't need to say your name. You can just put in the chat box. Okay, I'm from Nigeria, from Kenya, and all of that. Okay, I'm waiting for my responses. Okay, I can see Mohammed Chimo from Nigeria. I can see Gabriel from Zambia. Kedinda from Zambia. Abigail from Zambia. Paul from Kenya. Bryce from Zambia. Okay. Okay. You're all welcome. You can see Nuruddin. What did you say? Okay. So today we are here not only to witness the grand finale of the debate, but we're also here to celebrate every one of us, the vibrant mind that has been shaping the future of digital health in Africa and even in the world. So now the stage is gradually getting set for the teams to compete, and I'm sure we are, getting ready to learn and even for an electrifying performance. So right before that, we'll be having the opening remarks straight up. Thank you. Dr. Brown, you're welcome. Patrick from Rwanda, you're welcome. Dorcas from Zambia. David from Kenya, you're all welcome. And if you could drop your schools as well, it would be nice to know the schools you're from all over Africa. Thank you. Okay, so now we'll be having the opening remarks by network. Okay, so now we'll be having the opening remarks by Zakaria Sayatu, who is the Director of Operations, the Africa Digital Health Students Network. Please let's welcome him with her emoji. A round of applause. You're welcome, Zaki.
Yeah, thank you very much. Thank you. Good day, everyone. I hope I'm audible.
Yes, you are very audible.
All right. Yeah, good day, everyone. My name is Zakaria Seiti. I'm the Director of African Digital Health Student Network. So it's truly an honor to welcome you all to the grand finale of the Internetwork Debate Series and the annual closeout event of the African Digital Health Student Network. I extend my heartfelt greetings to our esteemed judges, Dr. Andrine and Dr. Doye, for joining us today. Our dedicated mentors also from the African Digital Student Network, and my team as well, the Digital Health Student Support Team, and our vibrant student members joining us from across Africa. I also welcome our guests who are here to witness today's exciting proceedings. Today marks a significant milestone for African Digital Health Student Network because this event is not only the culmination of our debate series, but also a moment to reflect on the hard work and remarkable achievement of our network over the past year. So together we celebrate the progress we've made in advancing digital health across Africa and recognize the collective efforts of every member of this dynamic community. As part of our efforts at African Digital Student Network, we have relentlessly worked to foster collaboration, innovation, and knowledge sharing, particularly among African youth passionate about digital health. Through mentorship programs, capacity building initiatives like digital health skills training, and engaging webinars, we have created opportunity to explore new ideas and contribute meaningfully to the growth of digital health in the continent. Also, I would like to give a special recognition to some exceptional team, such as the University of Lagos, University of Rwanda, University of Zambia, Ahmadu Bello University, University of Ibadan, Kenyatta University, and some other campus, all other campus network. If you are here, you can give a round of applause to yourself, please. Also, I would like to give a special recognition to their ambassadors as well. They've really done well this year. Your passion, hard work, and commitment are truly inspiring. To our mentors as well, your invaluable guidance and unwavering support have been instrumental in shaping the success of our students. Thank you very much. So I'm eager to witness the insightful debates and dynamic discussion we have ahead today. So let this be a celebration of creativity, brilliance, and innovative spirit to see what each of you are bringing to the table today. Thank you all for being part of the journey, and I look forward to an inspiring and enriching session. Thank you all. Thank you very much. So over to you, Damilola.
Thank you so much, Zaki. Please, if you're not speaking, kindly unmute or kindly mute. Yeah, thank you. So thank you so much, Zaki, for those motivating remarks. Your words have set the the perfect tone for today's event. You've reminded us of the importance of collaboration, team spirit in advancing digital health across Africa, and of course from Africa to the world. So before we dive into today's grand finale debate, I'd like us to take a moment to hear in, do I say the engine? Yeah, in the engine that drives this network forward. She's here to give us more insights into the African Digital Health Students Network, its missions, accomplishments, success stories, even vision for the future. So I'd like every one of us to join me in welcoming our head of operations in person of Vivian. So I'd like us to give her a round of applause to Vivian. Over to you, Vivian.
All right, thank you, team. Am I audible?
Yes, y'all.
Can you hear me?
Yes, we can.
Okay.
Yeah, people.
All right, awesome. Thank you so much for the warm welcome. And thank you so much, Zaki, for your warm remarks. Thanks for carrying this vision and bringing together a brilliant team to really help us put the vision into reality. So thank you so much. Thank you to the team at DHSN. Thanks to our judges, esteemed judges who are on the call with us today. Thanks to all our esteemed guests who have joined us. And thanks to all our amazing students. You are the reason why we are here today. And today my job is really to tell us about the Africa Digital Student Network. Maybe some of us are not aware, or this is the first time you are really hearing about this network and you're wondering, why do we need such network? Or why do we need to establish this kind of community? So I'd like to just help paint a picture of why we believe this is important and the traction we've been able to get since we launched in February this year. So I'd like to start by saying that we all are Africans and we understand how we are driven largely by our dynamic and rapidly growing youth population. So in Africa, as we all know, we have over 60% of the population under the age of 25. And this population is not just a statistics, right? It carries the potential for innovation and improvement, especially in our healthcare services, which is already at a stage, operation. But we believe technology can really help us bridge that gap and help us leapfrog and bring affordable, accessible healthcare services closer to the communities that need them, right? So what is the advantage of having this, youthful population and having the demographic advantage? We believe that, according to United Nations, the youth population is actually expected to reach nearly 830 million by 2050. That means that 1 in 4 people that you meet, on this planet by 2050 will actually be an African, a young African, right? And 42% of the world's youth will be Africans by 2030. So we need to really understand that this is not just numbers. The data are really telling us what to do and what to do with them. And we need to really start, empowering our generation, the next generation, so that they can realize their best potential and harness it towards developing our healthcare systems, leveraging their innovation and creativity. And we believe that involving young people is not just about tokenism or ticking the diversity and inclusion box, right? It's very vital for our economic growth, innovation, peace, and security in the long term. So at Africa Digital Student Network, what we've done is let's start empowering people pre-service to start understanding, what innovation is, what digital health is, how they can harness technology to support the ongoing transformation on the continent. We are like the new generation Gen Zs, we're all digital natives, right? And we believe that it's not just about using your phones or your laptops for Instagram, TikTok, and all those are fantastic. But there are other ways where you can also harness this creativity and innovation, going through design thinking process to really come up with ideas, fundable, tangible ideas, research driven ideas that can support or save a life in your community. So we're trying to empower the next generation of healthcare leaders with the necessary skills and knowledge that they need to leverage this technology for improving healthcare outcomes across the continent. And so far, since we launched in February 2023, we've been able to establish these networks across 19 universities across Africa. You could see the different countries in which we have some student network. And so far, we are in these schools, as you can see on the screen, different universities across Ethiopia, Ghana, Nigeria, Kenya, and the likes. And we have about 200, students currently onboarded into our community. So we have like a dedicated WhatsApp page where we engage our students day in, day out. And we're not just biased towards, oh, you have to be a medicine student or you have to be a medical student. We are really like multidisciplinary because we believe digital health is not just about healthcare. There are other, it needs finance, it needs ICT. And when you're talking about One Net data, you need the animal data, environmental data, human data, for us to have that holistic approach into solving healthcare problems. So we encourage students from, agricultural sciences, arts sciences, medicine, comms, education, wherever you are. So far you're a young person and you have a burning passion to make an impact in the healthcare system on this continent, leveraging innovation and research or data, we welcome you to join the Africa Digital Student Network. And so far, these are the things we've been able to achieve. Last year, we were able to, have a boot camp on digital health where we empower 64 young Africans. This year, we're able to do mentorship programs because we believe it's not just about empowering with the skills and knowledge. You also need to start understanding the industry know-how. So during our mentorship program, we pair our students with industry experts. They have one-on-one sessions, right, where you can ask questions, be vulnerable, ask your questions, get clarifications about your career path and journey. Where do you start from? What am I doing wrong? What can I do better? So we have been able to do it through 2 cohorts. We had cohort 1, then cohort 2, and each cohort had about 7 to 10 students who graduated from the programs. And thanks to all our mentors who really gave their time to support our students, to answer their questions and hold their hands on this journey. We're also able to implement a research bootcamp because we believe that we say we don't have data in Africa, but data comes from research, right? So we need to be able to learn how to do research and get those data out of research so we can then leverage those data to make informed decisions or to improve our innovations or even inform policy. So we believe young people should start having research skills, and not just because I remember I think had any research course per se when I was in uni. The only research I did was my final year project, and it was chaotic because we were never really taught how to actually do research, like guided step by step and practical aspect of that. So we believe young people should be able to do research so that they can have they can understand how to get data and leverage this data for innovation and to make informed policies and all. So we're able to establish this boot camp supported by our University of Ibadan network. They really worked hard to ensure we had about 50 young Africans where we empowered the research skills. And we are glad that at least from that research bootcamp, people who had not been able to do research before, they were able to work on some reviews, literature reviews here and there, and were able to submit more than 2 manuscripts for publications after the research bootcamp. Then lastly, just a few weeks ago, we graduated about 30 young Africans from our Climate Change Health Innovation Bootcamp, where we supported young people to understand climate health-related diseases and how they can leverage technology to mitigate and adapt to climate health-related issues. And from that boot camp, we went through the different stages of design thinking to come up with about 5 climate health innovations, which were pitched during the bootcamp demo day. Then we also do capacity building workshops. We believe that we should also empower you with the right knowledge, how to navigate your career in digital health, and also in understanding the different digital interventions or innovations that exist in the on the continent, and how you can maybe identify gap or come up as a young person on how to support this innovation. So we have different capacity building workshops we have done. And lastly, we're also very big on peer-to-peer learning, because we believe you can learn better even from your colleagues than when you are waiting for an industry expert to come and give you the juice and all of those things. But your counterpart, your colleague sitting next to you in the class, who have done amazing work, you can pick one or two things from the person. So we've established what we call Beyond the Classroom, which is a monthly series where we bring undergraduates. The people you're seeing on the screen are undergraduates, but they've been able to, do extracurricular activities to build themselves and gain global opportunities. So we believe others can also learn from them, learn from their journey. How do we able to manage, a lot of questions we get, how do I manage academic with extracurricular activities? People are doing it, right? Can you still hear me? Can you hear me? Am I still audible?
Yes, yeah, we can hear you.
Oh, okay, all right. So that is what we do during the peer-to-peer learning. Then lastly, just to bring us to why we are here today, which is the Digital Head Student debate series. So we also believe that we need critical thinkers as young people. It's not just to be excited about the hype of technology or excited about the exciting things that we all talk about now, AI, machine learning, and all. Sometimes it's important for us to also critically think about these things and develop and ask questions, be curious enough, to do more research, like beyond the hype. What is actually the how best can we maximize these new technologies and all of these things? So we believe the student debate series gives opportunity for our students to do more research about specific topics and come up with fresh perspectives, engage their mind in discussions about pressing challenges within the healthcare system. So we believe it's this platform is for them to build their critical thinking skills, communication, leadership skills, which I believe is essential for a young person to build as they come up in their journey, and also to build their leadership skills, as I've said, and promote cross-cultural collaboration. Because since we started round one, we've been able to match different schools from different countries together into different rounds so that they can debate against each other, share their perspective. So University of Lagos will come and tell us what's happening in Nigeria. Kenyatta University will tell us the same thing happening in Kenya with specific example. So we've been able to do that cross, cultural collaboration and bringing different perspective from different countries and background. So we've had different rounds, round one, round two, and we went through the semi-finals just a few weeks ago, where we have University of Ibadan network against the University and University of Lagos against University of Zambia. And today we are here for the final round, grand finale, between Ahmadu Bello University and University of Zambia. Today they will be debating on a topic which I believe is important for us to talk about. Will artificial intelligence enhance or diminish the patient-provider relationship? So they will be giving us their perspective about this, and we hope the best team wins. Thank you so much. So I will hand over to our moderator now to take us fully into the debate session. Thanks. Over to you, Damilola, or Princess. Thank you.
Okay. Thank you so much, Vivian, for that insightful and inspiring presentation about the African Digital Health Students Network. So I'm pretty sure some of us here who don't really have an idea of what the network is all about would have, gained one or two from her presentation. And as well to Vivian, thank you so much for all you do. Your dedication and leadership has been very instrumental in, driving the success of this network. And we truly appreciate all you do. So I'd like us to appreciate her once again with our virtual round of applause. So before we go into the debate, we would like to hear from just two of, we are having representatives anyway, two out of the excellent individuals who have been directly impacted by this network. That's our mentees, and also the ambassadors, because they are the voices that can truly embody the purpose of this initiative. And the experiences as well will, in a way remind us about all we do, all we are doing, and all we still want to do. So the first person to speak would be Mustafa from the University of Ibadan, who is an ambassador. Hi, Mustafa. Can you unmute and turn on your video as well? And let's hear from you. Thank you. Mustafa, are you here? Okay. Seems Mustafa is not here. How about Sampa? Is Sampa here? Sampa is from Zambia. Yes, Zambia. Is he here? Or is she?
Yes, I can.
Oh, sorry. Okay. Sorry, I didn't know. Can you please turn on your video if that's comfortable? Probably if you're in a convenient place, and let's have few words from you. Please introduce yourself and let's hear from you. Thank you.
Okay. Hey everyone.
Yeah, please go ahead. We can hear you. Hello.
Okay. Can you see me? Can you see my video?
Yes, we can. We can. Please go ahead. Thank you.
I'm Samantha, and I'm a DHSD ambassador for the University of Zambia. And it's such an honor to be here today and share a bit about my journey. And what I will talk about today is my journey as an ambassador, but most especially the mentorship program I took part in this year. And so when I first joined the mentorship program, I was only looking for clarity on what needs or space I could take up in digital health, or at least that's what I thought. But I didn't expect how much of a personal journey it would become. And it was through exercises such as a personal SWOT analysis that my mentor made me do that had me confront some tough questions about who I am, what I want, and what really drives me. And honestly, it wasn't always easy, but I think it's exactly what I needed. So this process really just helped me understand the opportunities in digital health. It really did help me understand myself. And from this, I realized that my purpose isn't just to find a career that pays the bills. It's to find work that feels meaningful to me, work that challenges me, and work that's actually going to create real impact. And so, to anyone here who's still figuring things out, well, I still am, I just want to say this: clarity doesn't come all at once, and that's okay. Take your time to ask yourself your hard questions, do the inner work, and just trust that every step you take will bring you closer to your purpose. I just want to thank Digital Health Africa for giving me the opportunity this year to serve as an ambassador, and because I've really learned so many lessons. Shout out to my mentor as well for guiding me on this path. It's truly been an enriching experience. Thank you once more.
Thank you very much, the student representative from Zambia. We'll have to go into the debate proper right now because that's one of the reasons why we are here, and we just want to hear out what the debaters have to say. So before we go into that, let me just give you a small introduction about this debate. Of course, the topic says, will AI enhance or diminish patient and provider relationship? We are here to learn if clinicians would need AI to interact with their patients, and would it help? Would it make things worse? Would it, so many arguments around AI. A lot of people are still very skeptical if we should use AI in the hospital for patient interaction. So let's hear from our debaters on this subject. Now, before we go on, I would like to make a small introduction of our judges. We already have our judges here in the house. And as you saw from the flyer, our judges are Dr. Imodoya Bureau, who is the CEO of Health Botics. And we've heard about him earlier, and he is a specialist in AI use for healthcare. Also, we would have Dr. Adrienne Brown. She is also a digital innovation strategy advisor. Gets to vet the ideas of our debaters, and we would also, just share ideas, hear from them, learn as well. Okay. If our debaters are already here, please, you can have the floor. Dami and I will moderate this, and then Zaki, you would help us with the timekeeping. Thank you very much.
Okay. Thank you, Princess. So, quick before we start, we have a few rules. But before then, our dear judges as well as the co-debaters are encouraged to turn on their videos during this process, right? And the rules are displayed. We have 5 minutes for the opening statement, and that's where you're expected to present your main argument, providing a clear thesis and supporting your evidence. You have another 5 minutes for the other team where they do the same. Then 2 minutes for the rebuttal, another 2 minutes for the other rebuttal, then 3 minutes for conclusion. So it's like 5 minutes for your opening statement. That's to each team, 2 minutes for rebuttal and 3 minutes for conclusion. So please, let's not go violent against each other, and try not to exceed your time, and don't go out of context. So yeah, just like I mentioned, please turn on your videos so we all can see you as you begin. So now I'll be calling on the debaters. For the University of Zambia, we have Sandra Chitalu. Sandra, are you here?
Yes, I'm here.
Okay. So how about for Ahmed Bello University?
Yes, we are here.
Okay, I think it's important for us to note that Ahmadu Bello University was supporting this notion that healthcare would help patient-provider relationship, while University of Zambia would be in opposition.
All right. So to start, we would have the Ahmadu Bello University go first. So you have 5 minutes for your opening argument. Over to you.
Can you hear me?
Yes, we can hear you.
Yes.
Your time starts.
Okay, can you see my video?
Yes, we can see you. We can see you, but then we'll make use of what we can see right now. But yes, we are good to go. Please go ahead.
Okay, you can see the video, right?
Yes, yes, we'll make use of. We can see you, don't worry. Go ahead.
Go on.
Okay, when the time has started, let me know.
Your time have started now. This is 5:37, so your time starts.
There's a story behind this book I hold in my hands today. It's the book I used throughout my second year to prepare for tests. So one sunny afternoon, while we were preparing for a physiology test behind the faculty building, I had a discussion with a close friend. He passionately argued about the supposed harms of AI in healthcare. I listened carefully, then I asked him, would you prefer a healthcare system that is overburdened and unable to meet the needs of millions, or one that uses AI to enhance care and accessibility? He paused and remained quiet. That particular conversation stayed with me because it reflects the concerns many share about AI. But I'm here today to address those concerns and show you how AI is not a threat, but an ally to enhancing the patient-provider relationship. Ladies and gentlemen, esteemed judges, worthy opponents, and audience, good day. I'm Ubaidullah Al-Hassan, a third-year pharmacy student from Ahmadu Bello University, Nigeria, and I'm here to affirm that AI enhances the patient-provider relationship. Let's begin with the reality today. We found out that in many African countries, we have an overburdened healthcare system. According to the WHO, the recommended provider to patient population annually is 1:1,000, but the reverse is the case in many African countries. In Nigeria, for example, we have 1:4,000. In Kenya, we have 1:5,000. In Ethiopia, we have 1:10,000. And in Zambia, we have a staggering one provider for 12,000 patients annually. In this environment, there's no doubt that artificial intelligence is needed as a transformative tool. Now to the question, how does AI serve as a transformative tool which enhances the patient-provider relationship? First, AI enhances efficiency and strengthens trust. By automating tasks such as scheduling, preliminary diagnosis, and documentation, AI makes work easier and more efficient for healthcare providers. We see AI applications already improving the dynamics in various African countries. In Zambia, Babylon Health uses AI for teleconsultations. In Kenya, Living Labs equips health workers with AI diagnostics. In South Africa, Discovery Health uses AI for predictive analytics. In Uganda, we have Matibabu, which uses AI for non-invasive malaria detection. There's no doubt that this application make work easier and more efficient for healthcare providers. Other than efficiency, AI also improves personalized care. On the global level, AI systems such as IBM Watson have the ability to analyze vast data sets which can be tailored to meet individual needs. Many critics argue that AI lacks care, but the point we miss is that AI does not provide human empathy. Rather, it complements human empathy. Where you have Mama BC, Mama George, Mama Chinedu, and Mama Kabiru in the same healthcare center, you leave the automatable tasks to AI and you are able to focus on their emotional support, and this enhances patient-provider relationship. We also have AI translation tools which are bridging the gap in multilingual society like ours, where we have hundreds of languages. We've spoken about efficiency. We've spoken about personalized care. Now to the biggest problem of all. What is the biggest problem? Accessibility. We find out that in many African countries, the rural areas struggle not only with quality healthcare, but accessing healthcare. According to statistics derived from CNBC Africa and Program for Appropriate Tech in Health, it has been found out that about 77% of Kenya's population lack access to healthcare. In Nigeria, it's about 60%. In Ghana, it is about 50%. In Ghana, it's about 50%. Even in a relatively developed African country like South Africa, about 30% of rural population do not have access to healthcare. Beyond Africa, we have a country like India where about 65% do not have access to healthcare. So how do we solve this problem? How? This is when AI-powered teleconsultation platforms come into the picture, which connects patients to remote specialists. These are not just talks, these are not just claims, they are also backed by statistics. According to a research published by Strathmore University, one of the leading universities in Kenya, and the new Partnership for Africa Development of the African Union, it has been found out that a very good example, it has been found out that M-Pharma has improved medication access by significant 50%. This means rural patients living in remote areas like rural areas are able to access healthcare 50% better than how they access healthcare, because they are now connected with quality health professionals. They are now connected with qualified health professionals. Ladies and gentlemen, let's be clear with this. Let's change our mindsets. AI is not an ally. AI is not a threat. AI is an enhancer. AI is a booster. Let's not continue to see healthcare as a competition between technology and humanity, but healthcare of the new age is a combination of the two. The future of healthcare is here. It is AI enhanced. It is enhanced by AI. It is human-centered, and it is built on stronger patient-provider relationship. Thank you.
Thank you, Ahmadu Bello University. University of Zambia, you have the floor for your opening statements. Thanks out now.
Thank you, Ms. Moderator. I hope my voice is clear and my video is visible to everybody. Good evening,
yes,
esteemed
perfect.
judges. Thank you. Good evening, esteemed judges, our invited guests, my fellow debaters, and the audience. Today, we have gathered to discuss whether AI will enhance or diminish the patient-provider relationship. And as the opposition, we are saying that definitely AI would diminish the patient-provider relationship. And here is why we say so. When I chose to do medicine, I chose it because of the patient-provider relationship that is there, the human touch of it. And this relationship is based on empathy, trust, and understanding. But this connection is being threatened to be replaced by AI. And now let me tell you a story. When I was going through my pediatric rotation, I came across a mother. This mother had a child who was gravely ill. The mother and the child did not just need diagnostics and treatment plans planned by AI. They needed someone to listen, someone who assure her that her fears are valid and that what she's going through is something that is emotional, and she has to understand that. And now we are being taught that AI is here to revolutionize the healthcare. But I ask, at what cost? Number one, AI risks dehumanizing care and erode the patient-provider relationship. Here is Miss Vivian, who walks into the hospital expecting to be greeted by a reassuring doctor, but no, she is greeted by a code screen. She therefore gets to a chatbot like Adapt Healthily or ChatGPT, which analyzes her symptoms and gives her a diagnosis, and she's told to go. Is that efficient? Yes, it is. But is it comforting? Definitely not. We also see a study from the Pew Researchers, which was done in America on American patients, which states that 60% of the American patients were uncomfortable with the use of AI when their providers use AI to plan their treatment plans and diagnostics. Members of the House, healthcare is more than algorithms. we should not make our patients data points, but it's the connection that is made between the patient and the provider. Secondly, overuse or over-reliance on AI by the providers would diminish that decision-making and erode the trust. Members of the House, AI does make mistakes, and when these mistakes are done, the end result is catastrophic. We see this happening in 2018 when IBM Watson cancer treatment was introduced. It was reported that it had mistakes starting from diagnostics and also mistakes in treatment recommendations. And when these mistakes are done, the patient's faith is shaken. And when patient's faith is shaken, they question the system. Not only do they question the system, they question the providers that give it as well. And remember, once trust is lost, it's hard to be rebuilt. Thirdly, we got to increase in the inequality in access to healthcare services. Let me take you to Sokoto State in Nigeria, where access to basic healthcare services is still a challenge. And with the introduction of AI, this inequity will increase. This is proven by the World Bank group study that was done, and it showed that only 36% of the African population is able to access internet services. And this shows how some people will be served with AI and others not being served. And with this inequity, then there will be an impact on the patient-provider relationship. When we talk of AI, the patient security and privacy cannot be ignored. And once we misuse our patients' personal information, trust will be lost. And lastly, we risk to lose compassion and empathy, which is the whole heart of medicine, members of the House. Algorithms do not feel. They do not hear the trembling voice of a patient scared of a diagnosis. And a study that was done in ENT, because it removed the human touch, and this evidence will be sent to the chat box. And this evidence will be sent in the chat box. And as we integrate AI, members of the House, we remove the heart of medicine, which is compassion. Yes, AI has brought
Thank you very much, University of Zambia. Up next for the rebuttal, Ahmadu Bello University. Please go on immediately.
Can you see me?
Yes, we can see you and we can hear you.
Good day, everyone. I'm Muhammad Abdul Wahab, a 400 level pharmacy student from Ahmadu Bello University, Zaria. My first speaker has spoken diligently about how AI enhances patient-provider relationship, and the opposition party have also spoken well. But I would like to address their claims that empathy and compassion. But let's be honest, isn't a rushed consultation due to excessive administrative work the true enemy of empathy? AI liberates providers from 50% of paperwork and administrative work, according to GS Hospital in South Africa. This gives the provider more time to listen to their patient and connect effectively. If this isn't building the relationship, then what is? Also, the fear of over-reliance and errors from AI is valid but overstated. AI in healthcare serves as a collaborative tool, not an autonomous decision maker. It enhances the capabilities of our providers in providing more informed decision. Take DEM AI for an example. DEM AI flags potential skin condition, but the final diagnosis and treatment lies in the hand of the healthcare provider. Moreover, AI systems also undergo testing and continuous updates guided by ethical frameworks and medical experts. They also say AI is impersonal, but isn't it more impersonal to make mistakes that cost lives? In Nigeria, medication error contributes to about 20% of preventable deaths, as reported by the Nigerian Medical Journal in 2022. AI significantly reduces such error by 30%, according to the study conducted by Lancet Digital Health. This is a whopping increase in accuracy. 30% more lives saved, 30% more families spared for unnecessary grief. If this isn't building trust, then what is? Before I go, let me ask the question, why do you think healthcare system in Africa is still very much retarded and backwards? Thank you very much.
Thank you very much, Madrid University, University of Zambia. Up next for your rebuttal. You have 3 minutes.
Good evening.
Good evening.
My name is Binda Tula from the University of Zambia, and we are saying that AI diminishes the patient-provider relationship. The proposing team has stated that AI improves diagnostic accuracy. But remember, if AI increases the diagnostic accuracy, that might be true. But is that what we are looking at? No. AI diagnostic does not necessarily mean that it has strengthened the relationship between the relationship. This has been supported by the diagnostic accuracy in the efficiency and the cost reduction. This does not equate to the empathy and the trust that is needed by these patients. This can be seen in the Journal of Clinical Psychology in 2018, which members of the House has become a big problem in the healthcare where we want to replace the empathy with machines. The proposing team also stated that AI personalizes healthcare. Members of the House, let's remember that the AI models are limited by the quality and the amount of data that is used during training. In short, giggle in, garbage out. This means that if AI fails to capture the intrinsic needs of the patient, then what good is it, ladies and gentlemen, to the patient-provider relationship? This can be supported by the Journal of the American Medical Informatics Association from 2020 in an article titled The Limitations of AI in Healthcare Decision-Making Process. Members of the House, the opposition team also stated that AI facilitates better access to healthcare. But let us look at our continent, ladies and gentlemen. We all know that people live in rural areas, some in urban areas, some in suburban areas. We all know that some are young people, others are elderly people. We see that AI, ladies and gentlemen, will hinder some of the effective ways of giving health in the digital illiterate people. This can be supported by the Journal of Medical Internet Research 2020 in an article titled The Digital Divide in Healthcare. Ladies and gentlemen, let's take this serious and consider that the access to AI must be for everyone. The proposing team also says that AI saves time for providers. Members of the House, it is true that AI can save time for administrative staff. But no, this time has now been translated into seeing more patients, not focusing on the deeper relationship that should be enhanced by the provider-patient relationship. This can be followed up by an article from the impact. This can be followed up by an article titled "The Impact of Electronic Health Records on Physician Time Allocation" in the Journal of the Journal Internal Medicine, from 2020. Ladies and gentlemen, let's take the healthcare of patients serious, because at the end of the day, no matter what comes to help the relationship between the patient provider, this relationship still remains a golden relationship that can never be broken by any system. This is where I end. Thank you.
Thank you very much, University of Zambia. The next phase is the conclusion. Ahmadu Bello University, you have the floor. You have 2 minutes.
I thought it's 3 minutes from the flyer. Yeah. Sorry? Can you hear me?
2 minutes, please.
Okay. AI is
You are not audible.
Are you there? We cannot hear you.
Many of you here today focuses not on whether AI enhances patient-provider relationship, but rather on the imperfections or barriers to its widespread. These challenges, such as accessibility, regulation, or societal acceptance, are external factors beyond the inherent capability of the AI itself. Imagine a patient receiving, so these claims are invalid concerning the patient-provider relationship. Imagine a patient receiving a timely cancer diagnosis because AI flagged irregularities in their scan. Imagine a clinician no longer overwhelmed by paperwork because AI is handling patient record. This is what happens when technology meets humanity. AI takes care of repetitive, time-consuming tasks, giving the provider more freedom to connect with their patient. When we argue that AI strengthens the patient-provider relationship, we don't just mean it makes care efficient. It makes care personal. It gives provider more time to listen and the patient more confidence to trust. Let me end with a story that deeply resonated with me. A few weeks ago, I saw a pop-up mail notification from Cora titled, "I caught my doctor using WebMD to prescribe me medication. Who should I contact to get him fired?" Encouraged, I decided to open it. It was all about a patient who was on 22 medications and a fatal drug interaction almost cost his life. But fortunately, when one of his prescriber started integrating AI to track these interactions, everything was okay. He concluded the story on the platform by saying, "I would rather my doctor check than end up on a corona slab like the doctor who put me in ICU because he didn't check." Ladies and gentlemen, I asked the question the last time, and I would like to answer it. The main reason why the healthcare system in Africa is still retarded is because we debate and argue on incorporation of technological advances, and AI is one of them. Ladies and gentlemen, healthcare has always been about innovation. From discovery of antibiotics to vaccine, every leap forward has faced a resistance. AI is no different. But just like other breakthroughs, it will prove to be a cornerstone in building a stronger, deeper, and more effective patient-provider relationship. Once again, I am Muhammad Abdulhab from Ahmed Bello University, Zaria. Thank you. Hello, can you hear me? Hello, can you hear me?
Yes, we heard you. We heard you.
Okay, thank you very much. I've concluded my.
Okay, so let's have the concluding statement from Zambia. Over to you. 2 minutes.
Ladies and gentlemen, the integration of AI in healthcare threatens to erode the most important relationship, which is the patient-provider relationship, which has been built on trust, empathy, and understanding. This relationship has become the cornerstone of healthcare, and a threat to it could lead to catastrophic consequences. Our concerns throughout this debate have been the depersonalization of healthcare by AI, which will overlook the unique patient needs such as empathy, and the diminishing of clinical. Can you hear me?
Keep going, keep going.
And clinical skills and critical thinking among the healthcare professions who are now over-relying on AI-driven diagnostics, also known as automation biases, to the real challenges in the community, such as our communication barriers in language and cultural context, and the challenges of patient privacy and data protection. Indeed, the threat to the patient-provider relationship must be everyone's concern. Ladies and gentlemen, here are our recommendations. First, we want to urge that there should be an urgent need of protocols that are going to outline when and how AI should be used. This will ensure that there's human accountability, which will safeguard against AI-driven errors and biases. Second, we must preserve the human touch in healthcare at all costs. We need to organize training sessions that are going to sharpen the clinical skills and remind the doctors and the clinical people who they are, who they were before this technology came in. This will guarantee that there's a patient-centered care, which will guarantee that AI remains a compensatory factor in the patient-provider relationship. Third, patient data must be protected at all costs. Members of the House must obtain informed consent before collecting patient data and ensure that there is compliance to the laws and rules that are governing this data protection. In conclusion, our solution prioritizes human-centered AI integration, preserving the patient-provider care, and promoting transparency, accountability, and inclusivity in an AI-driven healthcare system. Members of the House, allow me to end by saying, let us choose a future where technologies work for humanity, not the other way around. A future where AI enhances, not replaces the healing touch of the human connection. Thank you.
Wow, that was such a fantastic debate. Who else enjoyed the conversation? Please let's give them a round of applause. I think they really gave their best. They really gave their best. Please let's give them a round of applause in the chat session. It's not easy to do your research and be bold enough to present it either for, either against. It's a courageous and a bold thing to do. Let's appreciate them. Let's appreciate them. Well done, University of Zambia. Well done, Ahmadu Bello University, for presenting your point. So our judges have started collating the scores, but while they are doing that, would like to ask our audience if they have, questions for the debaters. So if you have questions for them concerning any of the points they have raised during their debate, you can raise your hand, then I would unmute or call you to unmute so you can ask questions. Our judges can also give remarks about the conversation so far, but this doesn't affect their point. Judges are already collating the points already, but we just want to make it more conversational. If you have questions for them, and if our judges have one or two remarks to give. Thank you. Dr. Doye, I see you're on mute. Would you like to speak?
Yeah. Sorry. Yeah, thank you very much. This has been such a wonderful debate. I have to say very big congratulations to both teams. I think you are well represented. I think all members of your school should be proud of the kind of work and the clarity of thoughts that you've been able to present today. You should be really proud of yourselves. Really great stuff. And I'm really hoping that you all don't just get entertained by the face value of what has been discussed, but you've taken away very valuable points around what has actually been brought up, because these are real issues that are actually affecting adoption and scaling of innovations in artificial intelligence across the world, not just in Africa, big issues around data compliance, big issues around depersonalization of care that happens with artificial intelligence, big issues around excessive burdens on the health workers in our health systems and the kind of help we should give them. So I really want to first say big thank you for organizing this, and I want to also say big thank you to the debaters for the quality of thoughts that they brought forward at this debate. I want to also encourage the teams to remember that this is beyond just an intellectual exercise. These are real problems that you could actually help with fixing. So if you've raised some really valuable points today about what we should be worried about and about why we should obviously not turn back from this AI journey we're embarking on both sides. And I think that these are starting points for you to now begin to think about how can you get involved? How can you ease some of these fears? How can you strengthen some of these advantages, right? That's how you get started, okay? Just one comment here to the team from Zambia. I thought your points were really great, but I want to just mention that when delivering in a debate, you want to, as much as you can, let your points logically follow each other. Sometimes if you start from somewhere and you go elsewhere, it makes it hard for people to follow you when you go through your debate. Second is that while in fairness, I believe that I was really impressed by some of the really valid points you brought up. I felt like you stayed a bit too much on one problem. The reasons why we should not dive headlong into embracing AI is a lot more than just the fact that it depersonalizes care. There are seriously much bigger issues. For example, AI spreads bias. There's literally a superstar article in the Nature about how artificial intelligence systems take biases that are spoken softly in medical rooms and amplifies it on a loudspeaker. Biases about Black people, biases about people of minority races that become super blown in these AI algorithms, even in diagnostics and in therapeutics. I feel like those are examples of issues that I felt you could also have touched on that would have been really powerful. While for the team that spoke for, I felt like from the start, you had a head start because you were arguing for technology on the African continent. In the African context, I feel like that gives you a head start. And so I also felt like because you had that head start, I personally kind of had a slightly higher barrier for what you were going to tell us as the audience, and I think you did well, but I also feel you should have spent a bit more time fleshing out some of the points you raised. You talked quite a bit around statistics and around examples, but you didn't really ever tell us what some of those examples actually did or how they actually fixed some of these problems that you talked about. You gave a list of, when I was counting, about 12 startups across your debate. And in all of this, you rarely ever mentioned beyond one sentence what one of those 12 startups did. And I think that's really great, but that's just a comment back for you. But thank you very much for organizing all of this. And yeah, that's my comments.
Wow, thank you so much, Dr. Doye, for the insight and for the feedback you've given us today. I believe the participants and even everyone on the call have taken that, and it's really important you mentioned those extra recommendations and feedback, and also highlighting what they could have added as well, and points that could have even worked for them according to the topic. So thank you so much, Dr. Doye. We'll take Dr. Brown now.
Thank you.
While we are collecting. All right, thank you.
Yeah, thank you. And to the debaters, such a great job. I learned so much through your statistics and also your personal stories. I think that it's necessary. Please keep going. And I really want to encourage you to also know that things can coexist in the sense that it could be possible that a provider is the main character with the patient, but that the provider can have supplemental help and that the provider can have this complementary support for clinical decisions. It's also, on the other hand, possible that this supplemental support, this tool, this AI, as we call it, could possibly have errors in it and of itself. But on the other hand of that, it's possible that the AI can also find errors that the provider has made. And so I think there are assumptions on both sides as well, even with all the immense research that you all have done. And I think we're going to continue learning on this journey. And I really enjoyed the machine learning and natural language processing and other examples that were shared. I think it's really important. I want to just congratulate all of you and your teams. I know this isn't easy to debate on such a topic that is in a lot of ways political. I look at things from a view of, if I were creating governance around this, I would absolutely include a lot of the mechanisms that was discussed in regards to privacy, data, and data security, for sure. And I know a lot of the digital health plans within the different nations on the continent are making sure that's included and making sure that it's up to standards. I would have liked to hear a little bit more about standards that could assist, but I understand that some of that is still growing, even with different nations around the world, regardless of where the nation stands economically. A lot of these things are still being created. And so I congratulate you all, and I am so thankful to be here with you today. Thank you.
Thank you so much, Dr. Brown, for the wonderful feedback, recommendations, and insights you have shared. So I know we have a question in the chat section. I know this is not just an opportunity to hear from the debaters, it's also an opportunity to learn as well. So there's a question here that how can AI in healthcare balance ethical considerations? What strategies should be adopted to regulate AI, address workforce challenges, and all? I don't know if Dr. D or Dr. Brown wants to just give one or two response to that, so that our audience can also learn from these conversations. How can AI in healthcare balance ethical considerations, fairness, patient trust, while ensuring privacy, accessibility? So I don't know if you want to, any of you can actually take that while we get this course in.
I know with what I've seen with a lot of the shifts that are coming in regards to governance, it's really important that those who are making these decisions understand the big picture of how technology works, how clinical workflow maneuvers in a facility or in some element of healthcare, regardless if it is pharmacy or if it's something else. It's really important that when those decisions are made in regards to what the rules are, or at least the basis, this framework of whence we're focused on, it's important for us to have our beneficiaries at the table for that, our professionals at the table for that as well, and also for us to answer questions that to answer questions in advance of them being provided to us. And for us to look at, if I am a patient, all of these use cases, if I'm the patient instead of the provider, if I am the developer of this instead of the person providing the algorithm, if I am, so I think everyone needs to put themselves in different shoes. And a lot of times we don't have control over some of that. And sometimes, depending on where the funding is coming from, there are already certain expectations that we don't have control over sometimes. So in this question, it's really important for us to ensure governance and our roadmaps and our frameworks to be aligned and signed off on to ensure accountability and ownership at the end of the day.
Thank you so much.
All right. Thank you very much. I think that question is super important, particularly for a continent like Africa. And I think Dr. Brown has really nailed some of the most important things. I think I would like to re-amplify the fact that when we're designing these structures, the people who are going to be patients in these systems need to be at the table. I think that's super important. I think we've made regulations in silos for years on this continent. And I think if we're going to do that with AI, we're going to get in real trouble real quick. But that being said, some of the real strategies that we need to really talk about are, number one, we need to fix infrastructural problems to address some of the real issues that the debaters raised today. AI is going to definitely accelerate the digital divide. The health access divide is going to get worse with AI. And so if we're going to really ensure that AI actually brings healthcare to the rural people, the less privileged, the challenged people that we're touting it to do, we need to first address the infrastructural challenges that make healthcare hard for those people to get in the first place. So the truth of the matter is that you're likely going to find AI-assisted diagnosis, clinical decision support systems, and things like that in the urban centers, in the centers where the more affluent patients can go to. You're not likely going to find that in the rural centers, where the people who really need access to healthcare are going to be. And so that's going to really be a big problem if you embrace AI head-on without fixing the barriers to access that already limit these people from participating. Things like internet connectivity, right? Things like the cost of mobile data, right? So you need to fix those underlying infrastructure, and that is government-led effort, not private sector, really. Second, very important, is like you need to regulate what data privacy laws exist. You need to regularize them. You need to centralize and streamline data privacy laws. The problem you're going to have with a data-driven system like AI is if you cannot feed, now I'm gonna be a bit technical, but I'll try to break it down. One of the strengths of an AI model, whatever type of model you're talking about, is the quality of data it's trained on and the diversity of the underlying data set. Meaning that the more diverse the data set is, the more accurate the model is likely to be. For you to get access to that data, in a diverse continent like in Africa, you need to ensure that the data sources are governed by privacy law that is equal from Cape to Cairo. So if you're going to have a data governance silo in South Africa, another one in Egypt, another one in Nigeria, another one in Kenya, what you're going to end up having is a lopsided model, right? A model that doesn't really generalize well, and it will not bring you the gains that this wonderful debaters have today talked to us about, that AI promises to bring to healthcare. And so one of the big strategies we also need to execute in adopting AI at scale across the African continent in the African context is our data privacy laws need to be harmonized. Yes, we need to protect patient privacy. Yes, we need to protect patients' data at all costs and ensure that we follow strict standards for accessing such data with consent. But very importantly, we need to ensure that the access to that data is seamless for the developers. If not, the developers are going to end up building models that only are pretty good at small subsets of things and pretty bad at a lot of other things. And since everyone is so enthusiastic about it, we're going to have a situation where we end up putting the AI model in the field to fight a problem that it's not really well trained to fight. And that's going to be a problem. And so those are two main really important things, in addition to me amplifying the very important point that Dr. Brown made. We cannot build these systems without patients contributing at the table, not afterthought, not after we've launched, not after we've sent the models out. From inception and design, we need to get patients involved, like she correctly said. So yeah, that's what I would say as my answer to the question around what strategies should we really be thinking about in adopting, developing, and scaling these AI-led initiatives. Thank you very much.
Awesome. That's such a fantastic response from judges, the experts. Thank you so much for the incredible responses you've given today. And I believe our audiences, our guests, students have learned one or two things from what you've shared. AI needs to be inclusive. It has to be patient-centered. Thank you so much. Without wasting much of our time, for our audience who have one or two comments, please, you can put that in the chat section. We might not be able to make you come off mute right now, so that we can go into the award presentation and announcing the winner of the grand finale debate. But before then, we always have something to say before then in ADHSM, but don't worry, this is the final before then. So we're presenting, so we've told all our students that to mark the year as a member of the ADHSN network, you will be awarded a membership badge, which you receive upon completing your evaluation form. So this is how the membership badge looks like, just to attest to the fact that you were here for the whole year 2024 in the network and you contributed actively to all our activities and you're engaged. So please complete the evaluation form, and this badge will land right into your email as soon as you're done. So that is that about the membership badge. So we also have the best student network of the year, and this is a network that has really stood out. They spent their time to participate in our activities, they engaged, and they also initiated a project, which was really fantastic. They initiated a project, not just being participants, they also added value to the entire network by initiating a project. So I know I talked about the Digital Student Research Bootcamp, and this was an idea that came from the best student network of the year, which is the University of Ibadan Student Network. Thank you all so much for being a great part of our year. And we are celebrating you today for the hard work and the excellence that have really set you apart and your dedication. To all the members, all the students, all the members, the ambassadors, Chidima, Mustafa of the University of Ibadan Student Network in Nigeria, thank you so much. We celebrate you for showing up and showing out, for not just participating, but also adding value to the community. Thank you so much. And this is to encourage other student network in the coming year, next year, also try to be active, participate, add value to others in your community. So we have our mentors as well on the call. If they could say hi. I know we have a pool of about 90 mentors who we've been engaging to support our students, guide them. So if we have any of our mentors on the call today, we just have two of you just say hello and just give us one or two remarks before we announce the winner of the debate. Thank you. Do we have any mentor on the call from our student mentorship program who would like to just say hello to us? We recognize you. And we appreciate you for supporting us with your time and enthusiasm and passion to see this network make progress. So do we have any of our mentors on the call? You can just unmute or raise your hands to speak. Yeah, I can see Nuruddin. Yes, go
Yeah,
ahead.
yeah. Hi everyone. This is Nordin Bukari from Canada. We work on a data-driven preventative care platform here. That is strictly focused on lowering the negative impact of chronic conditions on our communities and our economy. This debate looks really appealing and really insightful in the sense um, some of those things are really key to this of AI deployments within the healthcare industry, and also um, another thing we believe will make a huge difference is clinical validation, clinical trials. So all those things drive digital health safety, and I'm really happy to see such a debate being conducted in African country because we already don't have in Africa enough data privacy regulations in place. So I think we need to take things also slowly. And yeah, looking forward to seeing much more debate like these ones. And yeah, thank you for
Thank you.
everyone. And yeah, we always
Thank you.
there. Yeah, to
Thank you
have a
so
good one.
much, Nuruddin.
Mm,
Yeah, thank you for
mhm.
joining from Canada. Thank you for being part of our students, mentorship program and mentoring our students. Thank you so much. So if we have any other mentor, you can put in the chat section your comments and introduce yourself. We'll just go right ahead now to announce the winner. Can we have like drum rolls in the chat session? Like, are we excited to know who the winner of the? We've been on this debate series for months. Like, starting with round one, round two, cutting down the teams, and finally we are here today at the grand finale. Please put in the chat session, put in your drums, your excitement, fire emoji, because we have our scores in. Congratulations in advance to both teams. You've actually done extremely well because you went through all the rounds and you made it to the final. So I think that's something you need to be proud of. Okay. So but before then, join us. We are trying to go into a lot of schools in 2025, spread our wings and expand to more schools. In 2025, we have just 14 to 19 universities at the moment. So volunteer with us. If you are not yet in a student network, join a student network. And if you are really interested and excited about what we are doing and the potential, you can sponsor a student, data stipends, access to events, conferences, and different things we have in store for them in 2025, internship placements. So you can actually sponsor a student and you can check our link. Our website is live for the student network and see the links to these opportunities. We'll share with you in the chat session. Okay, so I would announce the winner now. No more, but before then. Okay, so let me share my screen to announce our winner. All right, there we go. So, revealing the winner of the debate, the African Digital Students Network debate grand finale, we have okay, technology is messing me up right now. But no, it's not a big deal. I can figure it out. Okay. So let me try. Let me try again on my end. Yes. So we have our winner, Amadu Bello University Network. Congratulations, 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 congratulations. So they have an overall score of 82 points, an average score of 82 points. Congratulations. Put on your video if you're excited for Amadu Bello University, Nigeria. So the cup came to Nigeria this year. And hopefully next year, we don't know where to go to, but then congratulations, Amadu Bello University. You've really done well. And also congratulations to the University of Zambia. Honestly, you guys also did well. You're a great co-debater. You've done amazingly well throughout all the rounds. Well done. And so for our winner for today, Amadu Bello University, you'll be going with a cash prize of 50,000 naira to say thank you, well done. Just to really encourage you, some of us, this is going to be the beginning of a journey for you to really, go deep dive into digital health, into research, into innovation, just to encourage you and to boost your interest and passion. You'll be going home with a whopping sum of 50,000 naira and also 1 month internship placement within the Digital Health Africa main team. And for the runner-up, University of Zambia, you also would go home with 1 month mentorship with a renowned, industry expert. You would shadow a leader. We have a program called Shadow a Leader coming up. So would attach you with someone in the field you're interested in for a month, and you could get hands-on industry learning. And you know us, we always have opportunities. So once we have more opportunities, both of you also have access to all of these exclusive opportunities. So well done. Thank you so much. And with that, I think we've come to the end of today's event. We hope you enjoyed. We hope you had a great time. I don't know if any of if the us have 1 minute to give us acceptance speech. You are taking the cup home today. So if you have any acceptance speech to give, show us how excited you are. You can come off mute and speak. Do we have any representative from Amadu Bello University? Or
Yes,
they've gone off to start celebrating?
No, I'm here.
Oh, okay.
Yeah, good evening, everyone. Ubaidullah Al-Hassan, the first speaker for Amadu Bello University. Thank you very much first of all, I would like to thank Digital Health Africa and African Digital Health Student Network for this opportunity, to learn more and to connect with vibrant students across the nation. Thank you very much. I would like to dedicate this award to our family members. We would like to also dedicate this award to all our students who joined us here, because everyone has their schedule, but they came here to cheer us on and to ensure that we are not alone and to provide morale to us. Thank you very much, everyone, for being here. And we would also like to appreciate ADHSN for the prize and for the opportunity you are giving us. We hope and believe that this will be the beginning of something beautiful, and by God's grace, there will be more to come. And we also assure you that there will also be more to come from our end. Thank you very much.
Thank you, thank you, thank you. Dr. Doye, Dr. Brown, thank you so much for being available and answering our calls. Thank you so much. To all our mentors, to all our students, you guys have been incredible. Thank you so much. And this marks the close of our activities for the student network for the year. As we are coming back bigger and back next year. And you can website and check us out I don't know if you can see the website on the screen. Let me know if you can see the website displayed on the screen. Check us out. We are doing fantastic work. So you can out. We are planning to move into more schools. So if you have schools who have not yet onboarded into the network, please, you can go through this link to register as a student to join the student network. And if you want to be an ambassador, you want to present your school, or you want to establish a network in your school, you can register as an ambassador. And you can be part of our work, the great work we are set to do. You can sponsor a student. Most of them, they complain about data to join some of our sessions and all. So you can sponsor a student so that we can give them data stipend. If they need to travel for conferences and all, we can also support them. If they need to pay for any journal to publish their work, we can also support them. So these are opportunities available. We have mentorship program, webinars, internship opportunities. The Student Debate Challenge we started today, and we hope to continue every year. We have AI in healthcare clubs, and this is supported by the Africa Canada Data and Data Consortium. They are supporting us to establish clubs in all our networks to train people on AI, train students, undergraduates on AI. We have happy hour. We are happy people. Even though we do serious work, we try to cool off as well. So if you're a student, you can join all of these opportunities. It's not just serious things. Sometimes we also have fun. And we do peer-to-peer mentorship, as I've mentioned as well. You can go through our website to see how you can establish a network in your university, what the eligibility criteria is. And these are some of our events. These are our ambassadors. You can meet some of them who have established network in their own school. And to all our members, to our team members, thank you so much. DHSD team members, Princess, thank you so much, Shola. Thank you, Olani. Thank you, Zaki, and everyone who has really contributed to the student network. And as I've said, we are open to move into more schools by 2025. So please volunteer with us. You can volunteer with us through the DHA volunteer. We're currently recruiting in DHA. So if you go through the form, you will see somewhere that states Youth Engagement Unit. So if you're interested in youth work, student work, that is where you should put in your application. You can join the student network. You can also sponsor a student. Thank you, everyone. See you next year. Bye.
Bye. Thank you.
Bye. Thank you.